over time, the body becomes, kind of almost can't even mount a response anymore in that tissue. That tissue's been kind of overcome. It becomes this kind of silent reservoir of these microbes that kind of hide out. This is again this idea of these focal infections, these silent infections that are in key targeted areas and tissues that have a profound effect on the body. I would say 9 out of 10 of my patients have a tonsil interference field.
This is Dr. Talks.
Welcome back to the conversation. Today I have Dr. Christine Schaffner. So happy to have you back.
Oh, thank you so much, Laura. It's always so fun to be in conversation, and you're a dear friend, and I'm glad we're doing this today.
Me too. I think you've been on every one of my last 6 events. So thank you again for being here. So let me introduce you for our audience who might not know you yet. You're a board certified naturopathic doctor. You've helped thousands of people recover from chronic and complex illnesses. You host the Spectrum of Health podcast. You have online programs, and you have a clinic in Seattle where patients can see you in person. And today we're going to talk about one of my very favorite topics, chronic hidden infections. And you're the perfect person to do this because we're going to be talking about the places where you don't expect hidden infections to be. So we're going beyond the gut. We're going beyond the lungs. I mean, people think about you get respiratory infections in the lungs, and you get gut infections and parasites and bacteria. And, people think of infections kind of being isolated to these places, but they really go everywhere, right, Christine?
Yeah. Those are just 2 of many, many places that are, hotspots for the body. And, as you mentioned, this is silent and hidden, infections. And so it's not so obvious.
Yeah. So what we're going to do today is we're going to go over where they are. We're going to talk about signs that you have them. We're going to go way beyond using prescriptions and supplements to remove infections. We're going to explore some other ways to help solve this. And before we get into, where these infections are hidden, I think we need to explain and define one really important concept, and that's pleomorphism. So let's start there.
Yeah, I'd love to. And, I'm a naturopathic doctor, but I've had the opportunity to also study what we're calling now in the US bioregulatory medicine. That was also known as biological medicine. It's has these roots in Germany, Switzerland, Austria, and they took ancient philosophies and principles and kind of a modern day lens, and then they, really have these kind of, I would say, 2 really main topics that allow me to help so many people, because the premise of this system, and again any system that really helps people, is that the body is very intelligent and it has this self-regulating capacity and it knows how to heal. And when we're in a role as a practitioner or a doctor, our job is to identify those hidden or obvious roadblocks, those obstacles, to allow the body to have the energy to do what we don't even know what the beginning of how while they do it. And so again, with bioregulatory medicine, we'll talk a little bit, I think, in this conversation probably about interference fields. You already have Dr. Moldovan about the mouth, and also there are other focal infections, the tonsils, the sinuses, how scars interact in the body, and then this idea of pleomorphism. So these are or this rather is this idea that we're talking more terrain theory, and we're not talking germ theory. So I'll just kind of get us up to speed there, because my job is not to kill every bug and a person's body that is coming to see me. My job is to make them adaptable, resilient, that they can encounter a stressor and it doesn't become a long-term stressor, chronic illness, and they can adapt and move on. And so when we think about the terrain rather than germ theory, it's our job. It's more of an empowering version of kind of how to look at the body, that we can strengthen and we can genetically optimize ourselves. We can drain toxicity. We can balance our immune system. There's many things we can do. And then when we encounter that stress, that toxicant, we don't have to have the same response as, the standard American, diet people would, and so there's a lot more that we can modulate, in that rather we get a virus or a bacteria, we encounter it, we get the same textbook symptoms, and everybody's doomed to it, and you only need a vaccine to clear it, and move on, right? That's germ theory. So pleomorphism is this idea that that we have microbiomes within us, and then we have, these different stealth pathogens that we can encounter, and we can actually change the virulence of either commensal flora or stealth pathogens based on environmental conditions. So this is maybe the obvious kind of like example I use. So there's a clear relationship with mercury toxicity and candida. This is pretty well known. It's known a lot in functional medicine now, that when people have really persistent candida overgrowth, you think, okay, they got to change their diet, they got to be on like no sugar forever, they got to be on antifungals. And why is that person not getting better or even getting worse? So candida is known to sequester mercury in its cell wall, and so it might even have an adaptive kind of quality to be allowed to thrive in the body when there is a high load of mercury. If people have had amalgam fillings, if people have been in a occupation with mercury exposure, if you're just on planet Earth or live on the West Coast, you're inhaling mercury, in some way, from coal burning. And so if you don't tend to the environmental burden of mercury in the body, you'll just be whack-a-mole with candida. But if you have this kind of idea of like, okay, if I drain the mercury out of people, if I use chelation when appropriate, that I can be more successful with my candida protocols. There's also the caveat there, when people get worse with candida treatment, there can be a neurotoxin, basically exposure with a release of mercury, when you're going through that. So it's, we know this with strep as well. There's a mercury and strep connection in the throat, especially. And so it's this dance, this kind of dynamic conversation and dynamic aspect of how our body maintains homeostasis, maintains the health of the ecosystem. And so we look at relationships, and I would say, for the purposes of our conversation, think of pleomorphism as this like relationship between toxicity and how that impacts your immune system, and how that impacts your ability to modulate your immune system, either clear or something and move on, or let something to kind of be resident and stay. And parasites are pollutant sinks as well. They'll sequester toxicity as well. So if you have a persistent parasitic infection, the same kind of idea holds. So I hope that made sense.
Yeah, I want to unpack pleomorphism just a little bit. Can you talk about it in context of H. pylori? I think that will help people wrap their minds around it.
Yeah.
Sure, it's really clear.
Yeah, H. pylori, I would say the same. H. pylori is commensal flora, right? We know that we have bacteria in our GI that reside. I think of H. pylori, when you think about the environment of the terrain, why is it so persistent? I think it's multifactorial. I think what I know to be true is when people actually have low stomach acid, so they're chronically stressed, they are rushing when they're eating. There's many things that have like slowed their digestive fire over time. That lower esophageal sphincter doesn't get the signaling to close as tightly as it does between the stomach and the esophagus. So then there's ligament laxity in that lower esophageal sphincter, and then people can feel basically heartburn, which is related to H. pylori, or the conditions of the acidic environment. It's like making people think they have high acid, but in fact, there's a lower acid environment allowing that commensal flora to then basically not have the brakes on it and to thrive and populate. So that's kind of one example. I also really, I love that you have Dr. Moldovan on your summit, and just think the oral microbiome is so interrelated to our GI tract. So if you have upstream toxicity in your mouth, if you have periodontal disease, or toxic mercury amalgam fillings, or cavitations, or root canals, you're basically swallowing toxicity and swallowing dysbiotic flora that can also basically affect the not only the stomach and the upper GI, but also the GI tract, the intestines and everything as well. So that would be my first thought there.
Okay, thank you so much. So now that we've kind of laid the foundation of where we're going to go and talk here, looking for hidden infections or finding hidden infections in the body are such an important piece of the discovery process when we're looking for root causes of chronic inflammation, health conditions, diagnoses, even something we were talking before we jumped on the camera together is mast cell, for example. You have to look for the underlying root causes of this. It's just not a matter of, just treating mast cell. There's other things that need to happen. So can you explain why it's so important for us to do this piece, that we look for hidden infections?
Yeah, and absolutely. And you're doing a great job in the summit educating. Like when people come to see me, I have this idea again, I remove interference fields and understanding about pleomorphism, but I also kind of look at buckets of why people are sick. And it's again exactly what your summit's about, toxicants, pathogens and trauma. And when we go into that pathogen, kind of bucket, this is also, there's a relationship, as I mentioned, between toxicity in the immune system and also trauma in the immune system. And that, again, is this pleomorphic idea. And there's this ecosystem. So we're made of microbiomes, mycobiomes. We have a virome. We have 370 trillion viruses that, epigenetically dance with us and are part of our milieu, right? So we're not meant to be sterile. Like that's never been, how nature intended. We have microbiomes in our brain. We have microbiomes in our lung and our sinuses and our, in our tonsils and our skin and our, obviously our gut and our pelvic floor and our bladder. There are all these places where those microbiomes can become imbalanced. So again, great people are going to be talking about toxicity and trauma. So within those microbiomes, and in this dance with the immune system, why do we allow things like Lyme and co-infections to thrive, or viruses and retroviruses, or parasitic infections, or fungi and mold? So what I have found is that there can be, usually, when people come to us, it's not like they get sick overnight, right? They're, but from preconception to how they were delivered to their family's choice of breastfeeding and vaccination to the stresses that they encounter to, okay, then you live in a moldy house, you get a divorce, and then you're sick. You know what I mean? It's kind of like this, again, this, it happens over time. And so, what I, want to share about that is that there's a slow weakening, like with all of this stress. I mean, it's very, stressful to be a human and, on Mother Earth, these days. There's so many things coming at us, right?
Yeah.
And, they subtly weaken us. I was talking to a patient, like we have to spend a lot of money not to be poisoned in America these days, right? And so that kind of slow poisoning also affects our immune system. So let's say, somebody had, strep throat, like a ton, and, like grew up, had a bunch of strep throat. And, over time, their buckets are filling in the other, departments, toxicants and trauma. Over time, the body becomes, kind of almost can't even mount a response anymore in that tissue. That tissue's been kind of overcome, and and it becomes this kind of silent reservoir of these microbes that kind of hide out. This is again this idea of, these focal infections, these silent infections that are in key targeted areas and tissues that have a profound effect on the body. I would say 9 out of 10 of my patients have a tonsil interference field. And when you think about the tonsils, we can just spend a minute on the tonsils,
Yes,
right?
please do.
So,
Yeah.
yeah. So just think about it. So, chronic strep, if you've had chronic strep, if you've had mono or EBV, if you had amalgams that are draining into the tonsils, or any root canals or oral microbiome, the tonsils sit at the base of the lymphatic system and then at the top of the gut associated lymphoid tissue. So they're actually, I kind of think the connection between the gut and the brain is in the tonsils. And so if you have this kind of, unhealthy reservoir of tissue that's silent, again, your body's not, telling you have a sore throat anymore. You're not getting, all those, acute inflammatory signals anymore. It's just kind of, it's there. There is an entry point into the brain, from the tonsils. The tonsils there can be these kind of highways for microbes to find themselves, into the brain through the nerve highways and through the cribriform plate. So in the olfactory system, and that can enter into the brain that can actually, be a source of microglia activation and all sorts of neurological symptoms. Again, the tonsils can also be at the base of the lymphatic drainage. So there are a couple routes for the lymphatic system to drain. So it's in the front of the neck, around the jugular veins alongside that. And then if you did a cross section of your head through the cribriform plate I shared, and then the drainage around the tonsils. It's also, when you think about the tonsils, think about there's 5 lymphatic tissues, the Waldeyer's ring, there's the adenoids, the palatine tonsils, the tubal tonsils, the lingual tonsils, and that whole ring can become, really a reservoir. So all of a sudden you have, poor drainage, through that route, and also migration upstream as well that can keep things inflamed. And then when you think about, swallowing and kind of the tonsils become weaker and don't defend you as well, like from your, the things you're encountering through your food and through breathing. And then more and more things travel down the lymphatic networks in the gut. And that can also perpetuate and keep your GI symptoms, in a chronic state, because you have this, I think about interference fields as not only you have these infections, but you have the biotoxins that they release that can kind of chronically poison the nerves, the lymph, and the circulatory system as well. So the tonsils are kind of like a big deal for us, because who doesn't have a problem with all of those things when they come to somebody like ourselves to treat. And so that would be a really a big hidden, I would say, focal infection, a big hidden source of infection that we can treat. There's different herbs that we can use, ozone, different tools to regain support there. The best kind of idea, like the clinical presentation around what I'm saying, is the whole world of pandas and pans. Like that is kind of a technical name for like upregulated gut and brain inflammation when there's a reservoir of infection in the tonsillar ring.
Okay, so one more, as we're doing this first part of our interview here, I'd love to touch on some of those other places that can be reservoirs for infection. So there's a few other hidden places. So let's unpack that before we go into, big solutions for this. So what are the other places?
Yeah. So just since we're, talking about, the tonsils, we'll just go right to the sinuses. I know in the world of mold, there's a lot of conversation around sinus dysbiosis. We have a whole microbiota in our nasal passages. And if that becomes out of balance, just like if it was in our gut, that can be a source of biotoxin activity as well. And the sinuses are very close to the brain, not only through the entryway through the cribriform plate, but the sphenoid sinus is right near the pituitary. And so, when we think about chronic inflammatory response syndrome, that is a kind of like a pattern that we see, like with mold illness and Lyme and biotoxin illness. And why I just mentioned that here is because Dr. Shoemaker came up with an idea that the biotoxins from sinus dysbiosis really affect the pituitary. And that's why we see a lot of antidiuretic hormone that is dysregulated. And so people who have this can be chronically thirsty, or they get up to pee. I know these patients because they come out of my office every so often to go pee throughout a, hour or 2 hour visit. So there's a direct connection to the brain. And when I'm a big, people come to help me, on a lot of levels, but, we talk about really helping the lymphatics and the drainage and improving cognitive health. And so if we have infection of the sinuses and the tonsils, that's going to be, again, an area of stagnation and a source of biotoxins that can keep the brain inflamed. You've already covered cavitations, but cavitations are really big. That can also poison the vagus nerve. So I think about, vagus nerve toxicity and infection. We know a lot of Lyme co-infections hang out in the vagus nerve. So people are talking about dysautonomy. And they're just talking about like gargling and singing and all that stuff, which is awesome. But, why is the vagus nerve disrupted in the begin with? And so I always look upstream and make sure my POTS patients and the dysautonomia patients don't have a cavitation. Just think about,
So So we do have a talk here with Dr.
Yeah.
Sandra Moldavon talking about cavitations, which are little pockets in the jawbone. Just in case somebody's wondering what that is, it's a little infected pocket in the jawbone.
Yeah.
So if you really should catch that interview with Dr. Moldavon because we talk about what to do about that. So go ahead, keep going, Christine.
Yeah, yeah, totally. It's just this area of necrotic tissue that never heals when you get your tooth extracted. And that can be due to the proximity. It can, some of these microbes can settle into the vagus nerve, again, the lymph, also the circulatory system. And so then, when you think about like, okay, what does vagus nerve toxicity and infection mean? So if we have, basically these toxicants and these pathogens starting to accumulate in these neurons that are make up this long nerve that has all these beautiful functions about engaging our parasympathetic activity and our heart and our lungs and our GI. And if that communication highway between the gut and the brain and the brain to the gut is starting to be full of microbes, toxicants, there can be a slowing down of communication, or even changes can even lead to cell death over time. And so that can be a big area, I think, of hidden infection, especially if people have any autonomic issues, which most most people with a chronic illness do. So we covered tonsils, we covered sinuses, we covered the vagus nerve. I'll just kind of, it goes without saying, but the brain has a microbiome, and we know that a lot of the pathogens that you're talking about can get into the central nervous system, and they can affect electrical activity and signaling and neurotransmitter release, and affect people not only from like insomnia to brain fog to depression, anxiety, and the list goes on. So a big part of our work is to try to clean up the entry and outflow to the brain so that we can get some deeper treatments to the brain to heal it. And then I'll say, I would say the next place, the appendix, the ileocecal valve, we talk about SIBO all the time. And SIBO is obviously something that needs to be addressed and treated. But when you think about what's happening is the bacteria from the large intestine are entering into the small intestine, from the large intestine into the ileum through this valve, wherever there's kind of a juncture, where one part of the intestine is entering a different part, there's a valve that kind of is entryway, or it can close off an entryway. And sometimes that valve can get stuck open. It can get stuck open or closed. And so that is right at the same area as the appendix. And the appendix used to be thought as vestigial tissue, that it really never mattered. We just evolved out of our use. And there are lots of thoughts that it can be a reservoir for probiotics. So when the body's gone through different periods of stress or antibiotic use, that reservoir can be released. But also it can be a pocket of where, if that area is not, like, again, that environment, it becomes pretty, the waters get muddy, right? The SIBO's happening, the valve stuck open, parasites can migrate there, fungi can migrate there, and there could be this low grade chronic appendicitis that's not acute, but is kind of like weakening and poisoning that area. So that's another one. And then I guess,
Christine, I have to say really quick, I'm going to say this moment right now is my most delightful moment of this entire project, is that I have such delight right now that the appendix could be a reservoir for probiotics. That just makes my heart so happy. I've never heard that before. This is what I'm going to think of every time I think of the appendix now. And I'm so glad I still have my tonsils. I don't have anymore. Got those out at 21, but I have my appendix, my little reservoir. Okay, so go ahead.
I know, right? I know. It's just the body's wise, right?
Yes, yes. So give us a couple more spots here where chronic infection.
I would say, let's talk about the bladder, right? So there are microbiomes in the bladder. I see a lot of patients with chronic UTIs and interstitial cystitis. And, the interstitial cystitis can be like a mast cell issue. But again, why are the mast cells so irritated? We always have to ask that question. And then chronic UTIs can be when there are, some, bacteria just make a home. When you treat Lyme and co-infections, it's often known that spirochetes like the bladder. And They can create biofilm communities, and biofilm is a big, I would say a source of hidden infection because, these microbes are intelligent and they can find ways to thrive within us. And biofilm, the creation of biofilm can be a way for these stealth pathogens to block the entryway of the white blood cells getting, through to help clear that. So the chronic UTI, idea is, there could be like a home base of, not only bacteria, but, I've seen parasites in the bladder. And then there's a cool test called microgen, and it, for people who have chronic UTIs or interstitial cystitis, you can take a capture of your urine and do a PCR test. And then Ruth Chris, who's a wonderful nurse practitioner who did a lot of work for this community, she's retired, but she consults with microgen, and she will talk to you about your patient and help you to do targeted antibiotic therapy, again, when it's appropriate, or herbal therapy to help resolve a chronic UTI issue. So just a plug for that, because that's helped a lot of my patients. And I could keep going. You
I
just
know. I
you
know.
want me to stop.
Okay, so we are coming to the end of the first part of this talk, but we're going to keep going. So, Dr. Schaffner, thank you so much for joining us today. This has been extraordinary already, what we've learned about chronic infections in the body, where they're hiding. In the next part of the talk, we're really going to get into when is it proper or when is it appropriate to kill? When do we start a killing process? Do we really want to kill everything? And ways to do this beyond, beyond the pills, beyond the supplements. What are some of the strategies? So, to our audience, I hope you found our conversation thus far insightful and helpful. I know I certainly have. If you're a Summit purchaser, stay right here because we're about to dive even deeper into this discussion with Dr. Schaffner. If you're not, just click the button on this page to get access to a continuation of this conversation and all the others, and get the tools you need to reclaim your health. If you're watching a continuation of my talk with Dr. Schaffner, thank you for being a valuable member of our community, and we're going to dive right back in. Okay, Dr. Schaffner, what we ended with, this whole talk about all the places hidden infections are at, and then you said, well, do you want me to keep going? So do you have a few more that we should unpack before we get into the kind of, what do we do about this? Do we kill them straight off? Is there some stuff that needs to happen first? What are the modalities to kill? Yeah.
Yeah, totally. So I'll maybe say two more things, maybe. I mean, I don't know, I could go on. I'll lump them together. I'll do two more. The joints, the joint capsule can be an area where Lyme and co-infections thrive. Spirochetes and other co-infections have the ability to degrade collagen and also to upregulate our own MMP9 to go deeper into tissues, and so they can traverse into joints, throughout the fascia, into cerebral spinal fluid, other, really collagen rich tissues like the heart and the eyes and so forth. So the joints are, a big one. If you have osteoarthritis or any type of arthritis, I'd highly encourage you to look into ozone therapy and to consider getting your joints ozonated, and maybe following that up with regenerative medicine from PRP to exosomes to stem cells to save your joints. So that could be an area. The other area, I guess, would go hand in hand, I would say. So when we think about the blood vessels, there's the endothelial glycocalyx, and then there's the endothelium. So in the blood vessels, it's well known that some infections like chlamydia pneumoniae or other, even Bartonella, I believe, can live in the endothelium. So they create biofilm communities within the lining of our blood vessels and live and thrive in this nutrient oxygen rich environment. So if you have any circulatory issues or cardiovascular issues, this could be a hidden infection. The circulatory system is very much tied into the lymphatic system. I'll kind of leave here, a lot of the action that's happening in the body is kind of the space between the cells, right? And the space between the cells is the beginning of our lymphatics, and a lot of that fluid gets drained into the lymphatics, and then the lymphatics job is to, drain and detoxify that lymph and what's getting removed in the waste, and also all the things that the bodies encounter, and return it to the circulatory system. On the way there, it's encountering lymph nodes and lymph organs to mount a proper immune response to hidden invaders. So when we think about, chronically swollen lymph nodes, or the spleen or the thymus, actually the tonsils are part of that lymphatic tissue as well. So I would say, your lymph nodes, your lymphatics are definitely an area where chronic infections can thrive.
This is such a good talk so far. Okay, so many questions, and I only have you for so much time. So, okay, so this question is, now everyone's thinking right now, oh my God, I want to kill these things. I want these out of my body. Like, and
Yes.
so a lot of functional medicine just goes straight for killing, and that creates a problem. So let's talk about when it's appropriate to kill, when we start a killing plan, what needs to happen first before we can actually safely help your immune system. When I say, we're killing stuff, we're also boosting the immune system to solve this, right? And
Mhm.
then we can get into, after that, some of the modalities that you can use beyond just pills and supplements and antibiotics.
Yeah, absolutely. So, when I kind of a patient comes to me and we approach, like, okay, where do we begin? I just want to say, you want to work with a provider that can help you prioritize, right? Because there's so many things to think about, and we can't solve them all at once, right? So how do we, really prioritize treatment? I employ not only my regular diagnostics and specialty labs, but I am a big believer in bioresonance and bioenergetics and muscle testing. That guides me a lot with my patients. But there are principles, and there is quite a, I would say, roadmap. So I, want to identify first, these areas of hidden infection. So I do that with these tools that I'm sharing. There's also like a clinical picture that you can often learn, and it's really a clinical diagnosis where these hidden infections might be. So it's hidden infections if there's a dental problem, or if there's scars in the body. That's actually, I want to know that. Do I go after all that at once? Maybe not, but I definitely will inject scars with procaine. That's a neurotherapy technique to open up the fascial network, the lymphatics, support the, energy meridians in the nervous system so the body can regulate and heal. I often won't really do much with the patient if they still have mercury amalgams. If they still have mercury amalgams, that will be the first thing I will try to get their body in a way to work with a great biological dentist to get their amalgams out. I find that when people have amalgams, they're very hard to treat. They can be quite reactive. Your hands are tied with detox agents, and it just, I have a kind of a tenant there that I like to abide by, because I know I've tried to, patients have taught me if I ignore that, we just run into problems. So kind of knowing where we are there, and then I'm a big believer in draining the lymphatics and, having lymphatic drainage on board. I think that's a huge piece. If the swamp isn't moving, it's going to be really hard to add anything to that system to work. We're just going to get into, more stagnation, more congestion, more flaring. So I think about that. I'm a big proponent of binders. We use a lot of Cellcore binders and chlorella, charcoals at times, and zeolites and modified citrus pectin and all that kind of stuff. And binders are very foundational because they're there to lay in the intestines when the bile releases, not only bile that helps to digest our food, but also where, biles are out of elimination. This is where a lot of our, endogenous metabolic waste and toxicants are coming out of, but also a lot of these mycotoxins, biotoxins, other toxicity. And so we need the, binders on board. I'm also a big proponent of supporting the organs of elimination. You kind of want to support every, but most patients have kind of a weak link. So we're thinking about liver, gallbladder, colon, kidneys, skin, lungs. In this day and age, patients are becoming more and more sensitive. And we mentioned already the mast cells. So the mast cells, there's underlying causes, but some people are so sensitive that you want to stabilize your mast cells and get a good mast cell stabilizer protocol so you can actually get and reach these root causes, and that your patient isn't having rashes and reactions, and you can't go deeper. I'm a big believer, also restoring blood flow and, getting above that endothelium, and also the endothelial glycocalyx. A lot of people have very thick blood, so that it's full of, spike protein and fibrin and, all sorts of things. So I use enzymes, and I like Baluchi and serrapeptase and Danshan and arterosil and, keep the blood moving. And then we also have to have a good sleeping environment, right? So sleep is really important. It's kind of the chicken or the egg, but sleep is, really critical for healing and repair and that lymphatic activity. So I just kind of, really try to create a safe sleeping location that's low in electrosmog. So turn off your Wi-Fi, don't bring in your, electronics, try to minimize blue light. And then kind of like, like that's like foundational, like those are like the foundations. And then, and this can happen, it's not a linear, it's dynamic, those are really important parts of my protocol. And then, I use, clinical signs and then, symptoms and muscle testing to help prioritize, what is the infection that we need to go after first. And, often, I know everybody wants like a cookie cutter way, but, there's an interrelationship. And so, and let's say parasites are coming up, I'll use my parasite remedies, but within parasites are often Lyme and viruses, and they can be released through parasite treatment. So we want to make sure, we have, support for the downfall of, the afterfall or after fallout. Yeah. Fallout of that. And so, that, or, like if we're going to be going after candida, like I mentioned, we want to make sure we have some, neurotoxicity mopping up so people don't get mercury, toxic. So I often layer, I do have, protocols that are pretty balanced, but I often layer, okay, is it parasite mold? What are we going after? And then some type of herbal strategy to support the body with, viral and Lyme and co-infections at the same time. That's very typical in my protocols. So that's kind of how I think about things. And then again, we're not going to kill every bug, but can we get the body down, the threshold, the microbial burden down, so the immune system can take over? And sometimes that's easier than others for individuals, depending on, what's going on with them.
So much good information. Okay. So I know I'm just like shooting questions at you. I want to squeeze as much out of you as I can. What I love most is that like 5 minutes before we came on here, I'm like, so Christine, I have this idea of how I'd like this to go. Are you game? And she's, yeah, this is Christine. You just flow. And so, okay, you're just pouring your brain out with no preparation whatsoever. Whatever you want to ask me, Laura, I love it. So here's what I want to know. I want to go beyond the pill. I want to go beyond the supplements, beyond the prescriptions, beyond this. There are many modalities that can help support your immune system and your body to clear infections. So yes, the supplements are important. Yes, sometimes prescriptions are important, but there's a lot left on the table by Western medicine for sure. And also, I'm going to say it, most of functional medicine. So what are the extra things you can do for yourself?
Yeah, absolutely. So I'll kind of just start with some foundations. So, I know you probably have people talking about this, but I'm a big proponent of, clean filtered water. I love structured water. I know there is a time for distilled water, but I'm a structured water person. It just makes a lot of sense with how we're wired to generate electricity and energy in the body. So filtered, structured, highly mineralized water is really foundational. And then I would say, that kind of circadian biology piece. So making sure that you don't have you're not surrounded by LEDs in your home environment, that you're using, more full spectrum lighting. There is a light, incandescents are going away. And so there's a light called Chroma Lux, which is a health light that combines incandescent and halogen, which is like a soft, warm glow. My friend Julie Conway told me about this. She's a glass blower, and, we're like, what are we going to do with without incandescents? And so I found those lights through her.
We're going to go back to burning candles, Christine.
I know.
So we're going to do, and we're going to go to bed when the sun goes down, and we're going to get up when the sun comes up.
Yeah, I know, totally. Yeah, so you're onto something, because, especially after sunset, if we over pollute our bodies with blue light, that can be, very confusing for our melatonin production or circadian rhythm. So, blue blockers at night, or you can get those kind of red amber lights at night that can help, kind of support your body in that way. What you mentioned with the circadian biology too, the circadian biology people like you to go out in the morning and get that sunlight on your eyes and see the sunset on your eyes at night, and that is meaningful. So I would say like those are going to be foundational. I mean, I'm a big proponent of teaching people to have like a meditation or gratitude practice. I think that's really important. You know that the heart is the strongest electromagnetic field generator in the body, and if your heart's not aligned, your brain is not aligned, your field isn't aligned, and that's a whole other conversation, but I'll plant a seed for you there. And then I have a clinic here and we do lots of exciting things, but I encourage people to have like their own home healing circuit. And there's way more affordable, than when I started, ways to do this. So having some type of, how are you going to eliminate on a regular basis? Because this is a marathon, not a sprint. Is it good? Do you tolerate the sauna? Is it going to be the sauna? Is it going to be the ionic foot bath? Is it going to be coffee enemas? Is it going to be all three? Those are great tools to have. Like, how are you going to move your lymph? Are you going to have a power plate or a vibration plate? Are you going to have a stone body wash or the flow vibrate? Drain your lymph on a regular basis. And then, I love ozone. I use a ton of ozone when it's done at the right time with the right support. Ozone is really great. I use it through UVBI, major autoheme, 10 pass, and EBU at my clinic. However, you can get a home ozone generator and you can ozonate your sinuses, you can put it in your ears, you can ozonate your water, you can do rectal or vaginal or even bladder ozone. And ozone is 3 oxygens strung together, and it creates an oxidative burst to not only kill pathogens, but also create a hormetic effect to upregulate your antioxidant pathways. So it's this very longevity, kind of tool. And then, me, I love the sound and the light and the frequency, stuff. So, sound, you can interact with that in lots of different ways, from mantras to humming to toning to listening to sound baths on YouTube now, to using tuning forks, all of that. I like the Weber technology for photodynamic and photobiomodulation. I also like red light and infrared light. I like the sauna space photon. So those are cool things. And then frequency, I love Harry Massey's Ness and the AO scan. I'm a user of that. And, there's just so many, emerging tools in that space. And, what we're learning, I'll just kind of end on this, is that, your functional medicine will work better if you combine, all of what we're saying, with those tools in the realm of, sound, light, frequency, meditation, gratitude, and intention. That is really kind of the beautiful blending of the worlds that, really goes to the root causes that are even deeper than, what we've shared. And it's amazing. We learn so much about the body. I'm always evolving my thought process, and my patients teach me every day. So I hope this was helpful.
It was so good. I can't even wait to go back and listen to it again. Pages of notes. I mean, I've got pages of notes. I love, it's like Professor Christine is here. Okay, so tell our audience where they can find you, because they can come to see you, but you better get your amalgams out before you come.
I'll help you with it if you need help. So I'm in Seattle, Washington, and my clinic's called eminencehealth.com. Eminence means the divine within. So that it was a name that came to me. And then we do telemedicine. So depending on where you live, we have lots of ways to interact with you over Zoom. And then I have a podcast, and I do all sorts of things. So I really appreciate you having me on.
You also have your apothecary, and you've formulated some really beautiful
Thank you.
botanical supplements and creams and, topicals that you can use to support lymph flow. And I want to shout that out too. How do they find those products?
Thank you. Thank you. Yeah, I created a line for the lymphatic system, more or less. And so that has been a passion of mine. And I have a website called iPothecary, like apothecary with an I, store.com, and you can find out more information.
Yeah, what you've created is so lovely. So,
Thank you.
Dr. Schaffner, thank you so much for pouring your love and light into this talk, into this community. I know they can feel it, even though they weren't here with us in person. They can feel how much you love humanity and what big work and heartfelt work that you're doing in the world. You're a mentor of mine, and I really appreciate you always being open and pouring your knowledge into me. I've learned so much over the years. So thank you.
That was very kind. Thank you very much.
And thank you for the delightful comment about the appendix. I'm very excited.
I'll send you a paper on it. I'll go find one.
I would love that. I would love that. And for everyone watching, I hope you've loved this as much as I have. And until next time, everyone, take good care. Bye now.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks, real talks from real doctors on the issues that matter to you most.